Well, as you can see, Dr. Sonia Saxena joins me now, so does Liz Fraser. Good to see you both tonight. Obviously, you wrote this report. I mean, how disturbed are you when you found these findings? I mean, children having to have stomach surgery, bariatric surgery, it's a disaster, isn't it?
Yeah, I mean, we think it's really tragic. What we had always thought was that obesity is a problem that we can defer until late adulthood. The problem is now occurring in early childhood, and it's really affecting teenagers. 3/4 of the admissions that we've seen are in teenage girls aged between 13 and 19 years old.
Lots and lots of tweets on this issue. Liz, let's bring this one to you. Robert Baker has written in and said, mums and dads are to blame. Simple as that. What do you think?
I find it very hard to argue with that. Quite honestly, it begins in pregnancy. In fact, we know that large parents, overweight parents, produce in general more overweight children, and it goes from there. And I find it extremely difficult to find any argument, really, to counter the idea that if you have a child, it is actually your responsibility while they're young to make sure they don't become morbidly obese. There is a clue in the word morbidly here that it's not very good for you. And one of the things that I think it's so fantastic that you've done this research, and I'm so glad it's getting such a lot of coverage today. One of the things that we have to get over in this country is our absolute fear of saying to somebody, you are overweight. We have a real cultural fear of that. We don't like to say that. It's taken as a criticism rather than as something to help people, to make their health better.
Sonia, you're also a GP, so when overweight children come into your practice with their parents, what do you say to those parents? I mean, are you critical to them?
I think I think what Liz has said is the key point here. There is a problem with recognition. In some earlier research that we've done at Imperial in collaboration with University College, again funded by the National Institutes, we're really grateful for them.
So what do you say to them?
So we want to open up sensitive dialogues, but straight conversations where we actually say that here is a problem, we need to raise this, tackle this together, and we need to make the link between the health status, being overweight or obese, and the health risk, because in our research we found that 80% of parents who know their child is overweight...
It's obvious, isn't it? I mean, it's obvious if your child's overweight, isn't it? I mean, Liz, what would you say is for parenting advice? Because, of course, you have to be very careful, don't you, what you say to a child about their weight. But how should a parent tackle it?
Well, you see, Emma, I think that with all things with child health, you just have to look at what the risks are to this child. And one thing I would really like us to start talking in the terms of with overweight is to equate it with smoking or drinking or living in a house full of asbestos. If you as a parent were to smoke in front of your child and give them lots to drink every day and lock them in a room with no fresh air and carcinogenic materials, you would probably be arrested for child neglect. Overfeeding them and letting them eat badly, in my view, should be seen exactly in those terms because it's as bad for their health.
Really interesting point. Is it a form of child abuse? Is it a form of child neglect? Because that child is going to have real problems when they're older. What would you say to that, Sonia?
I am concerned that parents are not recognising the problem and they're not making the connection with the health risk. In terms of neglecting their child deliberately, I think that no parent really is doing this in an active way. It is simply that we really need to help people recognise the problem better.
And should we be more radical? Should fast food be banned in schools or in vending machines? What you mean? Even in hospitals, there's all sorts of bad food you can get. Do you think it's time to be radical?
Every agency needs to get involved. I think that parents have a responsibility. The teenagers themselves, children are very aware of what's around them, and they need to start gaining independence. They're at a difficult time where they're pulling away from their parents anyway. So I think that getting the message directly across to children and young teenagers is a really good idea.
Just very briefly, I mean, they do. This is the thing I've noticed. We had no health education at all when I was at school. They are told time and time again, they know, nobody watching this programme does not know that fizzy drinks are full of sugar and are bad for you. So it's not to do with the knowledge, it's to do with getting the point across that we're not criticising you. This is for your health and you must make this change.
Liz and Sonia, thank you very much for your time tonight.